What if everything you've been told about chronic disease is missing one critical piece? Today, more than 115 million Americans are living with at least one chronic disease. But here's the part almost nobody talks about. Many of these people never felt sick. No fever, no pain, no emergency. No warning that something was wrong. They were living normal lives, going to war, exercising regularly, spending time with family. Then one routine check had changed everything. A doctor looked at a few numbers on a lab report. Suddenly they heard prediabetes, high blood pressure, high cholesterol. You're at risk for heart disease. How can someone feel perfectly healthy yet be diagnosed with a chronic disease? Was it sugar? Was it processed food? Was it seed oils? Was it stress? Those factors certainly matter, but they don't explain the whole story. There's another reason hiding in plain sight. It has quietly affected millions of people. Most of them never even realized it. Once you understand what's really happening, you'll never look at your health the same way again. It has quietly affected millions of people. Most of them never even realized it. Once you understand. Because this isn't just about blood sugar or cholesterol or blood pressure. It's about understanding what those numbers actually mean. Treating a number isn't always the same as improving your health. By the end of this video, you'll discover why chronic diseases seem to be everywhere today, let's begin. So what really happened? To understand this, years ago, doctors usually diagnosed chronic diseases only after people developed clear symptoms. If your blood pressure or blood sugar had already reached dangerous levels, treatment began. Today, the goal is very different. Doctors now identify health risks much earlier. Instead of waiting until someone becomes seriously ill. That sounds like a smart idea. It can reduce the risk of strokes, as medical research improved. Experts began lowering the thresholds for certain conditions. This means a blood pressure reading, or cholesterol level, or blood sugar result that once seemed normal, may now place you into a higher risk category. The person that didn't suddenly become sick overnight, the definition changed. Imagine you're driving 60 miles per hour, the speed limit. That used to be 65. Then one day, the speed limit drops to 55. You didn't press the gas pedal. You didn't change your drive-in, but now you're officially speeding. Something similar. That can happen with medical guidelines. Your body. That may not have changed dramatically overnight, but the way that your health is classified, that might have. This doesn't mean that doctors are trying to label healthy people as sick. Far from it. These updated guidelines are designed to catch disease earlier before permanent damage occurs. For many people, early detection should be the beginning of a conversation, not the end of one. Can be life-saving. However, a diagnosis, because numbers on a lab report tell only part of the story. Your sleep matters. Your diet matters. Your waist size matters. Your stress levels matter. Your physical activity matters. Your family history matters. And how you feel every day matters too. All of these pieces don't matter. Focusing on one number without seeing the whole picture can create unnecessary fear. The real question isn't, do you have a diagnosis? The better question is, what's driving those numbers? Identify the root cause. That's where real change begins. Now let's answer the most important question: what should you do? If you've been told you have prediabetes, high cholesterol, or high blood pressure. First, don't panic. A diagnosis is information, not a life sentence. Your body, that is constantly changing. Every daily choice shapes your future health. Instead of asking, what's the fastest pill to lower my numbers? Start asking, why did these numbers change? Are you sleeping less than 7 hours? Are you eating mostly ultra-processed foods? Are you moving your body every day? Are you carrying excess belly fat? Is insulin resistance part of the problem? Is chronic stress keeping your body inflamed? These questions that reveal the bigger picture. Small daily habits create big results. Eat more whole, nutrient-dense foods. Reduce added sugars. Avoid sugary drinks. Stay physically active. Build muscle. Through resistance training, prioritize. Quality sleep. Manage your stress. Work closely with your healthcare provider. Monitor your progress. Don't chase perfect numbers. Build a healthier body. Better health naturally supports better numbers. Remember, a lab report is only a snapshot. It doesn't define you. It doesn't predict your future with certainty. What matters most is what you do next. The earlier you understand your body, the more opportunities you have to protect your health. If today's video changed your perspective, share it with someone who believes, I feel perfectly healthy. Because sometimes the biggest health problems begin long before the first symptom appears. Understanding that today could change your tomorrow. Thanks for watching. I'll see you in the next video.